Thank you. Hmm. Hi everyone. I'm Dr. Sandeep Dawala. I'm a consultant urologist and a transplant surgeon and and an andrologist based in Sandeep Urology and Kidney Hospital, KPHV, that is in Hyderabad. So today I'll be telling you when to visit a urologist. So starting from the newborn life, starting from the day a person is born till the death, till the old age, whenever there is a problem in urination, that is difficulty in urination, you have to visit a nearby urologist. So what problems a person will be having when the child is born? That is, usually children cry when they have urine infection. So that is a warning symptom that the child is suffering from urine infection. They can't tell that I have a urine infection. So at that time, when the child cries during urination, or when the child has itch in the genital area, then you have to take to a nearby urologist. Or any deviation from the normal opening of the urine hole, that is external urethral meatus, or any problem in the genital, that is both the testis and the penis. If there is any problem, then you have to take to the nearby urologist. Next, when the patient attains adolescence, that is when a person physiologically, when he attains puberty, so there will be changes in the body. That is, the size of the penis increases, the size of the testis increases, there will be hair everywhere. So if the patient is not if the person, sorry, I'm saying patient, it's not the patient, it's physiological, it's the person. So if the person is not sexually educated, that is, there is no basic sex education, then the person becomes anxious. So just to make him lose the anxiety, you have to get a urologist consultation. Most of the Indian families, they don't discuss all the changes which I've told you openly. I'll tell you, there are many patients who I see are just having many serious health issues just because they don't have a basic idea about genital hygiene, that is how to clean their genital organs. If the patient is uncircumcised, that is, if the patient is not circumcised at birth, then even the simple skin retraction, that is pulling the skin back and taking proper care during bathing, also is not told to the person. So most of the times they don't clean it properly, because of which there will be so many infections. The infection spreads from down to up and they'll land in serious health problems. So this is the adolescent urology. Next, coming to andrology, if the person is like newly married and he has any problems in the sexual intercourse, that is early ejaculation, or any difficulty in getting his genital organ erect, that is, if there is any erection problems, then you have to visit a urologist. Or if there is any intimacy issues, or if the person is trying for children and they're not able to conceive, there is any problem in the semen or anything, then you can visit a nearby urologist. And if there is any difficulty in urination, that is, the stream is reduced, or if there is any urgency, or if there is any burning during urination, or any difficulty in urination, or if they are not able to control the urine, that is called urgency. Or sometimes women often, they tend to leak the urine whenever they cough or sneeze or laugh loudly, which is a social embarrassment. So at that time, they can visit a urologist. And coming to the core urology, when the patient are diagnosed to have any kidney stones or ureteric stones or bladder stones, any type of urinary stones, then they have to visit a nearby urologist, because based on the size of the stone, the treatment varies. For some stones, just the medical treatment will be enough. For some stones, there is a surgery which is required. So the decision making and all should be told by a urologist. And if when the person reaches little older age, that is 40s, 50s and 60s, the prostate size increases. So for which the person presents with all the difficulty in the urination, just like the symptoms which I've told you before, the stream decreases, patient urine color changes, will be reddish in color, or the night they will be getting up many times to pee. Getting up only once during night or 0 times during night is accepted. If it is more than once or twice, then there is some problem in the urinary tract, for which you have to visit a nearby urologist. Nowadays there is treatment for almost everything, every problem there is a treatment. Previously there were only open surgeries where the patient used to land up in big scar after surgery. Now it is only keyhole surgery, that is laparoscopy, or we have more advanced robos where we can operate within no time, and the patient also can be discharged very early, where the quality of life is improved. So whenever there is a problem in the urination for males or females, they should not hesitate. They have to visit a nearby health worker, especially preferably a urologist. Thank you. Any problem, you can contact me. I'm situated in SANDEEP Urology Hospital in KPHB behind Nexus Forum Mall.